Good. Today's our third visit. How are you doing?
Good.
If you're watching this video, it's probably because you have sciatica or have had sciatica. Sciatica is a neuropathy. It's a pinched nerve. Fancy word for saying a pinched nerve. And the sciatic nerve comes from right here, L4, L5, L5S1, S1, S2, and S3. So from 5 branches of nerves in the lower back that come together to form the largest nerve in the human body, the sciatic nerve. It's about as thick as your thumb at its thickest point, okay? And it runs through the piriformis right in here and then down the leg. And it can cause numbness or tingling or pain. Oftentimes gets worse when you're sleeping or, most importantly, sitting a long period of time, which all of us do. Paul here, you are not a student anymore, right?
Yep.
You are a student. Okay. So he's a student. He's sitting all day. How many hours a day are you sitting?
At least 8 hours.
Even if you're not a student, most people are sitting all day. It doesn't matter. But when you have sciatica, or if you have a disc protrusion or a disc prolapse, that will make you more susceptible to sciatic nerve pain. And he has had it in both legs, right? At different times?
Yep.
So he's had it in both legs at different times. We are on treatment number 3. Today's our third visit. How are you doing?
Good.
Okay, any pain down your legs?
A little bit tight on the upper leg.
On the upper leg?
Yep.
In the front or the back?
On the back.
In the back. So up in here in the butt region?
Yep.
Okay, so that's not considered any longer sciatica, right? Technically, in technical medical terms, it's when it goes past your knee, right? Or up to the knee, right? So he was having some of that discomfort down into the back of the thigh. He's not having that anymore. That's better. Now he's just got it more localized here in the butt region where the piriformis muscle is and where the sciatic nerve passes through. Now 50% of the population has the sciatic nerve pass through the piriformis. It acts like it's split, kind of like a tongue, like a snake's tongue, and then comes together at the other end. And some people have the sciatic nerve that goes through it, and other people have it just goes under it. If you're one of those people that has your sciatic nerve going through it, it may make you more susceptible to piriformis syndrome. And he's got a little bit of that, where the piriformis muscle is entrapping the sciatic nerve, but also he's got most likely a disc injury. We haven't done an MRI yet on him, but that's most likely what we would find, either a disc prolapse or a protrusion. All right, so now we're going to do Cox Flexion distraction technique, because this is the gold standard when we're dealing with sciatica or any kind of neuropathy or disc injury in the back. The gold standard is Cox Flexion distraction technique. It's very gentle, extremely effective, and only about 2% of the population that gets sciatica needs surgery. And he's definitely not among that 2%. He's part of the 98%. The reason I know this is because he already had quick resolution of his symptoms in 2 visits. The cases that require surgery are typically, sciatic cases that are going on for 8 weeks and not improving. That's worrisome. And typically with this technique right here, Cox Flexion distraction technique, we get at least 50% pain reduction in 4 weeks. And oftentimes it's much faster. And in his situation, obviously, it was much faster than 4 weeks. But that's a minimum of 50% in 4 weeks. And that's in a really, really severe case or a post-surgical case. Yes, this technique can also be used if you've had back surgery. Important to know that. Not every chiropractor practices this technique. This technique requires a special table and a certification in the technique. Just because they have the table does not mean they're certified in the technique. How you doing here?
Good.
Any pain into your legs at all?
Nope.
Good. So you said you were feeling it a little bit into your left glute or your right glute today?
Left.
Quads are a little stiff. I can tell you've been sitting all day. So now with the Cox Flexion distraction, I'm going to do something called Thompson technique. And you heard that table come up, pop up. This is another gentle technique that's very effective when used in combination. Because he's been sitting on the tailbone, it pushes it up into the lumbosacral joint, creating hyperextension of the joint. So we want to prevent that, because if you see here, it's also called facet syndrome. If you have hyperextension of the lumbosacral joint, you're going to put more pressure on that sciatic nerve. We're trying to take the pressure off the sciatic nerve. Okay, lay on your right side. We're going to loosen up that piriformis muscle on the left. Slide down for me. Okay, so we're just going to loosen up his piriformis, his glute, and just get that hip, that range of motion a little better and help with that soreness. So you're going to kick this leg forward and touch the corner of the wall with your toes and then bring it all the way back against my leg. Go ahead. Good, and back. Good. A little sore there?
Yep.
Good. And all the way back. Okay. Good. Excellent. Good, and one more. Okay, now we're going to flip over to the other side. Sometimes we do both sides, sometimes we don't. He's had double-legged sciatica, so we're going to do both sides, and also we don't want to make this right side jealous of the left. Just kidding. All right, good. Swing it forward, bring it back against my leg. Good. Which side's more sore?
Left.
Good. Okay, now I'm going to have you lay on your stomach. So we're going to start with this side up, the right side up. So lay back down on your left side. So folks, here we're doing a mixture of three techniques. I did Cox Flexion distraction technique, Thompson technique, and now I'm going to do a very gentle side posture. I don't do this a lot with disc cases because it's a little bit riskier. You got to be very gentle and just relax yourself, okay? Take a deep breath in and blow out. Good. And the other side up. That went really easily. So did a great job of relaxing. Okay. Again, this is not my preferred technique if we're dealing with a disc case, but his pelvis was really off and this is his third adjustment. And sometimes we have to do that the first one or two adjustments and relax here. Yep. Okay. Now lay on your stomach. Now, when we bent his legs, they were stiff, like they just sort of wouldn't go past a certain point. Better. How does that feel to you? They're still a little stiff.
Yep.
Less pressure on your lower back when I do that?
Yes.
Okay, turn over on your back. And cross your arms in front of you, like that. Good. Tuck your chin, tuck your shoulders, do a half of a sit-up. Come on up. And blow all the way out. Head back. And another deep breath in. And blow out. Head back. Good. And hands up in the air. So this right here is a psoas muscle check. One of a few different ones that I do. Relax here. Always want to check the psoas muscle when we're dealing with back pain or sciatica. And you feel that right there? This vertebra right here, C1, works and moves in conjunction with the lowest vertebra in your lower spine, L5. So we're going to correct that. Both were subluxated today. For those of you that don't know what a subluxation is, it's when one vertebra is out of alignment compared to the vertebra above or below it, causing irritation of the nerves and the soft tissue around that joint. Really gentle adjustment here. Good. All right, you're all set, champ.
Thank you so much.
All right, thanks for letting us shoot a video of you.
Yep, no problem.
All right, come on up, see how that feels. And thank you folks for tuning in. If you have sciatica, make sure you check out one of our other videos that we did for sciatic nerve stretches to help you alleviate your sciatic nerve pain. Thanks for checking us out.